Thank you, Minerva. One of my passions, I think, is looking at some of the problems that our patients have. And as I look at my patients, I also look at this nation as a patient. And this nation and my patients have problems. The big problem that we have is in this country is our health care. And our health care is suffering. And in the few minutes that I have allotted here, I would just like to go through a possible solution that we should be looking at. So next slide.
Further?
This is my I am proposing, and I think other people have, that what we do in this country is we take Medicare and we extend it all the way down from our seniors to prenatal. And I have a name, Americare. I'm sure somebody has that name already, but I think we are going to have to name something and do something about our problem. And this, I think, is one of the solutions that we should look at. Next slide. And so I call this prescription for our daily ills. And next slide. And what is Medicare? Medicare simply, right now, for most people, is anybody over 65, not anybody, but you do have certain qualifications, but most people who are 65 or older have health care in this country. It's not really that simple, but I'm not going to go into the details right now because unfortunately details mask some of the problems that we might be facing beyond that. So and go back just once again. And so one of the things in the lower part, fee-for-service and Advantage, are the two main types of Medicare. Advantage is the HMO side, and I am a fee-for-service doctor. I'm on the other side. So why would this country want to extend Medicare all the way down? Well, for many reasons. We already have a system already. This system, Medicare, has been around since 1965. And with this system, we don't have to start developing a different system because it already exists. The paperwork is there. They've been doing it and tweaking it for many years, and it does seem to work. I'll tell you that in the 30 years or so I've been practicing and the 23 years I've been here, they have changed the system many times, but it always, for the most part, it always is for the better. They have made quite a few mistakes, and sometimes it is detrimental to the patient, but the doctors, the public, everybody turns around and says, let's change it the way it's supposed to be. And I will tell you, it really does work. As I mentioned, to prenatal, the physicians are allowed to make decisions. In many circumstances of healthcare in this country, physicians are not allowed to make decisions, and they're forced to look at the profit margin as opposed to patient care. Denial of care is not common. Out-of-pocket patient costs are minimal. There are certain, in terms of the cost, the patient still does pay 20%, and that 20% gets into more detail that we can't go into tonight, but some of those things are very easy to overcome, and our seniors have an easy time of figuring it out. They must follow the rules and guidelines of Medicare. As I said, that is constantly tweaking, and as most of you know, we're going to electronic medical records. That is ongoing right now at our hospital. We are doing it, and everywhere by Medicare standards, we'll have to, even in an office, you will have to have electronic medical records. And the other nice part about this whole system, this Medicare or Americare, is that we might be able to incorporate workman's comp. Next slide. So what are the ongoing Medicare problems? First of all, as you all know, fraud. Every time you look at Dateline or 60 Minutes, you'll see a program that talks about how much money is being lost in Medicare. And there's $20 billion alone being lost through the durable medical equipment fraud in our country. And that's just a piece of it. And we have to clean that up. They have not done a good job of straightening that out. people get away with the monies out of probably 99 out of 100 times. There are some patients that will abuse the system, and other countries have dealt with this too, who have like a Medicare, national health care, and they have worked through making sure that those patients who do abuse the system either pay more or have to suffer certain consequences. We all talk about tort reform. The Republican Party has put that forward, and by the way, I am not a Democrat, but I am not a Republican either, but I do believe, like Minerva said, that it's really important that we all work together, and one of those ways is tort reform. We don't pay for glasses, dental work, and hearing aids, and we do need to do that. And of course, right now with the Medicare costs, they're not looking at these as possibilities. But remember, quality of life for our seniors right now is being able to see. It is being able to chew food, and it is being able to hear. When you don't have that, you really don't have quality of life. And we need to find a way of making sure that those people, seniors right now, and those covered by Americare will get glasses, dental work, and hearing aids. Right now, physician payment, the low return for physicians is causing problems, and next slide, causing problems with the physicians to disenroll from Medicare. And because they do, we are losing more and more physicians for that reason alone. We don't pay real well to nursing homes, and we don't pay at all to boarding cares, adult day health care, and in-home care. And of course, we need to take a different attitude because these ways are the ways that we keep people in their home. Finally, Medicare Part D, as you all know, was written by lobbyists for the drug companies, and we need to shuttle that and push that out of the way and do the right thing and make sure our patients throughout the country get cheap, inexpensive, but good medication. Next slide. So how do we pay for this? Well, they've talked about that if we do a system like this, they're going to have to ration. We don't need to ration. We don't need death panels. I am a hospice physician. I do believe that end-of-life care is really important. Discussion like that almost never takes place. At my hospital, when I go in, on our board, we can see what patients are DNR. When I walk into each floor, all the patients that are DNR are my patients. Most of the doctors have no way or are not able to communicate end-of-life care, do not resuscitate, or any that type of decision making. We need to better communicate with advanced directives, do not resuscitate, hospice care, and end-of-life care that we're seeing, the euthanasia, which we now have in Oregon and the state of Washington. Doctors, patients, families, social workers, psychologists, they must all play a role in making sure that this discussion takes place. Next slide. So how do we achieve this? Well, we have to minimize discussion from the lobbyists, insurance companies, and the politicians. Unfortunately, when they are involved, it skews the whole ideology of what we can do. And until we take it upon ourselves as a people to bring this forward, we are not going to get Americare through. Next slide. Healthcare should provide a maintenance of quality of life, minimal pain and discomfort and death, dying with dignity, right to die, right to choice, and dying together. And that last one is from the Titanic, and the Rosenbergs, who were an elderly couple, died together. And here in Santa Clarita, every few months you have two people, one who murders and the other who commits suicide. In this community, every few months we have that. It's in the newspaper, it is happening, and I do think there are people out there who are now discussing right now how they're going to take an overdose or deciding how they're going to take their lives. And this is our last slide, which says what Minerva wants to say. And I hope we do have further discussion on this, because I do think this is a major problem. We need to communicate over, and whether Republican or Democrat, whoever you are, you really need to make that effort to, with doctors, with the attorneys, with the legislature, to make sure that we solve this problem. This is not something that is a problem that we cannot solve. We just have to make sure that the discussion takes place. Thank you.